well, there is a God. Finally, the word is starting to percolate, maybe, or I don't know, maybe it was the weather. News is, straight off of USA Today at Dallas, the Susan G Komen for the Cure is canceling half of its 3-day charity races next year because of a drop in participation levels. Hallelujah, and pass the hat. The word is finally starting to spread that the MDs are absolutely horrible at treating cancer. While the MDs, while we've given them $600 billion with a B, $600 billion, that's $500 billion plus $100 billion. Do you know how much $1 billion is? It's a lot. It's 1,000 million. $1,000 million is $1 billion. We gave them 600 of those piles. You know how closer to a cure for cancer we are? Not any closer. Cancer statistics have remained completely unchanged. It is so bad. Cancer is so bad. The cancer treatment outcomes are so bad that the American Cancer Society completely moved the goalpost years ago. Now they don't even talk about a cure. They talk about a 5-year survival time, but they don't tell patients that. They don't tell patients that, oh, the statistics are based on a 5-year survival time. They just tell patients, oh, this treatment is 50% successful. The patient hears is 50% of the women or men who get this treatment are cured, when in reality, what they're meaning is 50% of the people who get this treatment are still alive 5 years from now, but then they die eventually from cancer. And in the meantime, the treatments have created an unbelievable quagmire in the quality of their lives. Personalities change. My mother died of not of ovarian cancer, but of chemotherapy. My mother, God rest her soul, was diagnosed with ovarian cancer, I think 10 years ago, more or less, how time flies. And she was one of the nicest, most optimistic, friendly, loving, fun women you'll ever want to meet. She was awesome. My mother was awesome. God rest her soul. Chemotherapy completely altered her personality. I mean, it altered it. I didn't know who my mother was anymore, and neither did anybody else. You could still see a little bit of her in there because it couldn't collapse her soul. But for goodness sake, it collapsed everything else and made the last 2 years of her life an unbelievable hell. Costing, I don't even want to know how much it costs, because that would just make me furious. I don't even want to go. I don't even want to go there. There's some things I needn't not know. But the fact of the matter is, it's like this for everybody. Chemotherapy doesn't work. Conventional medical treatments for chronic diseases don't work. This is why autism is getting worse. It's why Alzheimer's is getting worse. It's why our life expectancies are getting shorter. It's why arthritis rates continue to climb, especially in Canada. I mean, 50% of the Canadian population, 50%, that's like 17 million people have arthritis. The MDs are clueless about how to cure it. They can't even cure heartburn, but they can manage it. We talked about that on yesterday's show. And I got my statistics wrong. I was reading statistics from 2008. The largest selling drug in the United States is Nexium. Nexium. Crestor, which is a cholesterol-lowering drug, is third. The second largest selling drug is an anti-schizophrenic. I forget the name. I'll think of it in a minute. But Nexium, a heartburn medicine, is the largest selling medicine in the United States. And people buy more heartburn medicine than any other type of medicine. Now, does heartburn medicine cure heartburn? No. It manages it. And it manages it poorly. And into the bargain, what heartburn medicine does is it completely eliminates your body's ability to produce any stomach acid. When you take a proton pump inhibitor, your stomach acid dries up 100%. And when your stomach acid is dried up 100%, how do you think your body's ability to digest food is going to be? Is it going to be good? No, it's going to be horrible. Your body won't be able to digest very many things out of food without proper stomach acid. It will be able to digest a couple of calories out of it because there's still going to be some bile, there's still going to be some pancreatic acid squirted into the digestive tract further on downstream. But when you remove the stomach acid, which is the lion's share of the digestive process in the human body, when you remove that, what you end up with is massively accelerated nutrient deficiencies. Now, number one, there isn't enough nutrition in the food anyway. Number two, When you eliminate stomach acid from the dominoes of digestive influence, you can't digest anything out of your food except a handful of calories, so this accelerates nutrient deficiencies. And since nutrient deficiencies are the root cause of all chronic disease, the more proton pump inhibitors and antacids that people take, the more chronic disease is going to be widespread, and that's exactly what's happened. And then into the bargain, when you throw pharmaceutical drugs into the mix to try to fix the problem, you're just going to complicate things and get all kinds of side effects, which is why medical care in the free world is so unbelievably expensive, because it doesn't work. And not only does it not work, but it complicates things into the process. It makes things work. It adds work for the doctor. It adds work for the hospital. Adds work for the nurse. The drugs don't work. They make things worse. Of course, with the exception of trauma care, right? I mean, you have your leg blown off in Iraq. Thank God for morphine. Thank God for the sterile technique. Thank God for microsurgery, which is awesome. But for chronic disease, bringing your body to a medical doctor is a fool's errand. And, you know, the Susan G Komen Society, which is basically a front for the pharmaceutical industry. By the way, let's just hypothesize, okay, that the Susan G Komen women, they run in Chicago and they raise $5 million for breast cancer. And they give that $5 million. Who do they give it to? They give it to the American Cancer Society. Who do they give it to? They give it to the drug companies to do research. Now, let's say a drug company came up with a drug that reduced the occurrence of breast cancer by 10%. 10%. That would be a huge breakthrough in the world of medicine, right? Cancer reduction by 10%, it would be a giant best-selling overnight sensation drug. How many of the women, or how much of the American Cancer Society, are they going to get a cut? Are they going to get a piece of the action? Are they going to get a piece of the revenues generated from the sale of those drugs? No. I mean, why would you do that? Because you've put your trust in the wrong system of medicine. You've taken the wrong dog to the hunt. You didn't know any better. That's the only reason that this type of nonsense persists. And by the way, reducing the occurrence of breast cancer by 10% would be revolutionary, right? Well, hold on to your hats. Selenium supplementation, selenium being a mineral, it's cheaper than dirt because it's made from dirt, reduces the occurrence of breast cancer by 82%. 82%. Now, why aren't the Susan G Komen women marching for that? Is that a pretty good number, 82%? You know what that means? That means if every girl in the United States, if every girl in Trinidad, if every girl in Canada, if every girl in Australia, if every girl in Ireland, Sweden, Switzerland, Germany, Africa, took one 200 microgram capsule of selenium a day in one generation, we'd eliminate the occurrence of breast cancer by 82%. Is that not worthwhile? Why don't you know this? Why doesn't your child know this? Why isn't this taught in school? And why did Dr. Wallach have to sue the Food and Drug Administration so that we could say this legally? I'll tell you why. Because it's a for-profit, runaway, monopolistic train of medicine in the U.S. The medical industry does not have your best interests in mind. It is a for-profit runaway train. If it was humanitarian, if it was medical, if it was science-based, a legitimate organization trying to end human suffering since 1998, it would have been mandatory in the United States to take selenium. They would put it in the food, just like they put iodine in salt. And by the way, not only does it reduce breast cancer by 82%, it reduces lung cancer, prostate cancer, and colon cancer. Remarkable degrees. 60, 70, ridiculous amounts. One simple essential nutrient, selenium. That's just one of the 90 essential nutrients we recommend. Imagine what the other 89 do. Are you starting to get the picture? Science-based, clinically verified medical nutrition is the wave of the present that will parlay into an unstoppable future force. Get on the train now.